Welcome back to Newsmax now. As we mark the 6th anniversary of Obamacare, the Supreme Court began hearing arguments today on a new case targeting the Affordable Care Act. Attorneys for a group of nuns called the Little Sisters of the Poor and other nonprofit religious groups are challenging the law's mandate to provide free contraceptive coverage to women. The court ruled in favor of Hobby Lobby when it challenged the same mandate back in 2014. While the Supreme Court weighs on that mandate, rising health care costs weigh on the minds of millions of Americans, and Obamacare may be making matters worse. Earlier, we spoke with Newsmax health editor Tate, author of the #1 New York Times best-selling book, Obamacare Survival Guide, about the scope of this problem. How bad is it?
It's bad and getting worse, if you believe the latest reports. Just this week, just today, in fact, H&R Block revealed that about most of the filers that are filing, we're only halfway through tax season, but people are paying twice as much on average for fines for not having insurance as last year. A new poll finds that only 15% of Americans say that they have been affected by Obamacare and helped by Obamacare, while 1 in 3, according to this poll, were hurt by Obamacare. And there's a new study out that suggests that as many as 29% of cancer patients cannot afford the chemotherapy. So what all these
Why
things...
cancer patients?
Well, cancer patients are paying a high cost for chemotherapy drugs primarily, and because there are no cost controls in Obamacare and there's no real provision to help those folks pay for those high costs, those costs are going through the roof. Now, this comes on top of studies we have looked at that look at premiums that have been rising. This year they're going up by about 7.5%, which is about twice the rate of wage growth, and deductibles are rising too. So the bottom line here is that the Affordable Care Act is in many ways a misnomer. Healthcare costs are continuing to go up.
And people over the age of 65 especially are being hit hard, correct?
They are. Medicare is still picking a lot of those folks up, but if you're over 65, you tend to pay twice as much for health care as someone under 65. So the more services you need, the more costly they are, and the more money coming out of your pocket.
Now, you mentioned people are going to be, their fee is going to be doubled this year for people who are uninsured.
That's right.
Round about how much are we talking?
2.5% of your income. Now, there are some upper limits and some limits there on the ceiling that you can hit, but it's a lot more than the first year, which was just 1% of your income. So I think folks are going to get hit in the next month when they go to their accountants and say, what do I owe if I don't have insurance?
All right. Well, thanks for all the great news. Hopefully we'll see some changes with this election. Tate, thanks so much for joining us again. The name of the book is a New York Times best-selling book again, Obamacare Survival Guide.